Let's take a moment and readdress that concept that we talked about, facial rejuvenation versus facelift. So we kind of drove this point over and over and over again that a facelift is not equivalent to facial rejuvenation. It's a tool and it addresses mid-face, jawline, and neck. There's a lot more that can be done in facial rejuvenation. When I see a patient that comes in and says, Dr. Athre, I really like a facelift, my job as their doctor and surgeon is I start the consultation off with this question. If you had a magic wand, what would you do? And the reason is I really want to see what that patient's view of themselves is. When they see themselves in the mirror, what do they see as their problem areas? So once I've taken that, then I do my assessment, look at the patient, and then I formulate a game plan. So an example of how I do this is as follows. I look at 3 categories of items. First, I look at structural issues. Structural issues are things like tissues have fallen. So to make a list of some of the structural procedures that are possible, a brow lift, upper eyelid surgery, lower eyelid surgery, the facelifts, which we have been discussing about, loss of structure of lips, so we can do a lip lift. So these are all examples of procedures that address structural issues. The second major category I look at is volume. Where has volume been lost? Okay. And when I look at that, for example, most patients lose volume in the temporal region. They lose volume around the lower eyelid region. They may lose volume around the lip region. And there's a lot of procedures that can be done to replenish volume. Some of that is fillers. Some of it is fat transfer. Sometimes a lip lift will address not only the structural issue with the lip, but also the volume aspect of the lip. Chin implants. So these are all categories of things that can be done under the volume category. So far we've discussed structural category, volume category. The third category I look at is skin quality. When I talk about skin quality, I look at this as all the other stuff that we're doing is like baking a cake. Okay, so you bake this beautiful cake, then you gotta put beautiful icing on it. That icing is skin quality. So what is the quality of the skin? Is there a lot of aging in the skin? Has the skin lost its thickness? Is there a lot of fine lines in the skin? And basically there are procedures that can address this. For example, chemical peels, stem cell facial, fractionated laser. So once I look at these 3 categories, which is structural, volume, skin quality, I come up with a master game plan. Kind of, if I could do everything, this is what I do. Then take the patient's wish list, smash them together, and figure out what the patient wants to do, what the patient's budget is, what types of procedures go together, what types of procedures can be delayed. So we come up with a holistic game plan so that the patient understands they have multiple options in order to achieve their goals. So I think this is a good way of doing facial rejuvenation, and the main take-home points of this is that a facelift is one type of facial rejuvenation. There are tons of ancillary procedures that can be done, and all of these procedures smashed together gives you a blueprint for facial rejuvenation, and that blueprint is individualized for every single patient.